Hi everyone. This is a case of a Rottweiler around 3 years of age, a female, presented with a history of bloody diarrhea, hematemesis from past 3 days. So we got all the blood work sent. So we started symptomatic treatment. So considering the symptoms, we gave water phase, we gave malaxicam since the temperature was on 3.9, Tribivit, RL. To, to avoid the fluid loss, we gave hetastarch, DNS, antacid pantoprazole. Uh, since the temperature was high and a bit of enlarged lymph nodes, we started doxy and steroid prednisolone to control the inflammation. We gave buterfanol since there was a lot of discomfort to the pet. So later on, we received a blood test, something like this: a elevated leukocyte count, elevated neutrophils, markedly reduced hemoglobin with a normal erythrocyte count, normal platelets, elevated SGPT, severely elevated alkaline phosphatase, elevated GGT, and severely elevated bile values, and marginally elevated urea values, and even the phosphorus. So, suspecting pancreatitis, we sent the lipase test and it came 1310. That means it is a case of severe pancreatitis. So, even though we had started the treatment, we suspected something called as leptospira, tick fever, pancreatitis. So we thought of going with a scan because severely elevated ALP was so much questioning. Generally, it can be correlated to a tumor mass within the abdomen. Severely elevated bile values, it can be correlated to few things like biliary tumors, or maybe bile duct stagnancy or stenosis, or maybe blockage of the bile duct. So we went with the scan. So in this picture, you can see we saw a bit inflamed pancreas, so that we were confirmed with the pancreatitis. Same image again, but you can see a severely distended gallbladder, so which was correlated to the values. So I just wanted to explain one thing. Any of the practitioner who is treating a pancreatitis case, he generally can exclude, I mean, he can go with the differentials to exclude the differentials like leptospira, like tick fever. During the scan, the spleen was normal. So the platelets here is normal, even though the lymph nodes were a bit enlarged and the temperature high. So we can rule out tick fever, something like this. You have an option of PCR. You can also go ahead with that. So we were having a very big confusion. Is there any tumor in the abdomen or not? We went thorough scanning of the abdomen, but there was no tumor found. But clinically, when we see this thing, you can see in the image one where there is a dissection of the gallbladder. You can see the gallbladder here, and the gallbladder exit the biliary ducts, which comes and enters the stomach somewhere here, exactly here. You can see a greenish point is there. So in the second image, you can see where exactly this is running, next to the stomach and pancreas. So whenever we see severe pancreatitis, obviously during the inflammation, we will see the enlargement of pancreas. And whenever there is such an enlargement, this is a single duct which gets pressed by the pancreas itself. And even though the exocrine pancreatic acids may inflame the gallbladder duct, so it will get stagnated. The bile will be get stagnated, and henceforth you can see completely distended gallbladder here. So, and the elevated values, what we saw here, like the elevated ALP, GGT, and complete total bilirubin values, is attributed to the gallbladder blockage. and there won't be, and henceforth, if you have proper ultrasound, there won't be any doubt between tumor related to ALP elevation. So this is what I wanted to clarify in this. And beyond this, since we have elevated liver values to so much, and there is no post 12 hours, there is no diarrhea, bloody diarrhea. This is within this treatment, we have stopped using heta starch. There are some contraindication indications there. And since the temperature is normal, we have stopped meloxicam, and rest of the treatment holded the same. Since we were confirmed with very low chance of leptospira and nil chances of tick fever, we shifted from doxy to meropenem there. Yeah, this is what I wanted to say. Thank you.